your recording as well.
Are we good to go, Barbara?
Yes, ma'am.
All right, good afternoon, everybody. I'd like to call the meeting of the Social Connectedness Task Force to order at 11:33. First order of business, roll call, please.
Commissioner Loops,
Here.
Commissioner Caldwell,
Here.
Commissioner Nelson.
Here.
Madam Chair, you have the quorum.
Excellent. Next up, we'll go to the approval of the minutes from our previous task force meeting on May 21st. We need a motion to approve the minutes.
Moved, Cole.
Moved by Commissioner Kowal, seconded by Commissioner Lubes.
Okay.
All in signify by saying aye.
Aye.
Excellent. Alrighty, moving on to the approval of the agenda. Are there any changes or corrections to the agenda? Very well, seeing none, we need a motion to approve the agenda. Moved by Commissioner Lubes as support by
Commissioner Cole.
Commissioner Kowal. All right, all in favor, signify by saying aye.
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 All those opposed? All right, motion carried. Next up, we'll move on to public comment. Is there anyone from the public who would like to address the Social Connectedness Task Force?
We currently have one caller on the line, and we can open it up for 3 minutes. Caller 1, would you like to speak in public comment?
How can I unmute myself?
You're unmuted.
Oh, great. I don't have any public comment, but it's almost impossible to understand anybody but the person who is currently speaking.
If you don't mind speaking slower, we can understand you.
I don't know what you just said. Only the person who asked me if I had a comment, who's close to the phone, I can understand, but I can't understand anything else.
Okay. Would you like to speak in public comment? I can communicate for you.
I have no comment. I just like to listen.
Okay.
But I can't understand it. That's my point.
Okay. I will fix the audio and find another way for you to connect. There's currently no other callers that are on the line for public comment.
Okay, seeing none, I will close public comment. Alrighty, moving on now, we'll move on to our regular agenda. Agenda item number 1 is our AAA-1B COVID-19 Aging Network Needs Survey Results and a presentation by Mr. Jim McGuire.
Yeah, I am going to, if you give me a second, I will share the
presentation.
yes. And of course I was ready. Okay.
Actually, I can make some preliminary comments before the presentation. How about if I do that, Barbara, while you
Perfect. Thank you,
have the
sir.
presentation? Thanks for the opportunity to address the task force. First of all, I'd like to say a few general comments about social isolation, because it's a broad, generic term that means sometimes different things to different people. Are you able to hear me okay?
Yes. Yes.
Okay.
Yes.
Excuse me. Social isolation is often referred to as loneliness or a lack of social connectedness. And increasingly, it's being identified as a public health issue and recognized by particularly health systems as a influential social determinant of health, which I think is you all are aware, and it's part of the reason for this task force. Loneliness has also been found to be a contributing factor to fatal conditions such as heart disease, and poses a number of other health risks that when you look at the rate at which social isolation can elevate your risk to health problems, it has a health risk impact that's comparable to obesity and smoking 15 cigarettes a day, various studies have documented. And I thought it was interesting, an AARP, Public Policy Institute study found that social isolation adds about $7 billion per year to the annual cost of Medicare. And that most of that cost is attributed to the increased risk of hospitalizations, which can be very expensive. The other thing I wanted to say is while social isolation is kind of defined in different ways, we've focused in our survey that I'll talk about on what are the specific measures, objective measures, and things like living alone, living in a socially isolated place, or self-reporting of loneliness. These are kind of the key factors or way that we've used to measure social isolation. And of course, research on social isolation has found that it is a trigger of just in terms of the medical impact of social isolation, it actually triggers a biological reflex of a heightened inflammation in the body that can be harmful when it persists over time, which I found that was very interesting that there's a social, I think there's a lot of information about how inflammation has a lot of negative consequences related to personal health. Barbara, how are we doing on the PowerPoint presentation? Are we able to get the presentation up? There we go.
Oh, great.
Okay. And I think there's about 7 or 8 slides to this presentation. What happened is in August of 2019, we used some of our agency dollars to fund a needs assessment. Actually, we call it a needs and solutions assessment of older adults in the county. It was a telephone that was conducted by Mitchell Research, which is a professional research team. And what I want to do is share with you some of the findings. It's important to me because we talk about social isolation, loneliness. I always believe that it's important to being kind of a data-driven organization to have a little bit about what the sense of the magnitude of the problem. In fact, 100 people, 1,000, 100,000 people, information like that is often obscured. And so we tried to uncover some of that through this survey. Barbara, am I able to advance the slides or do I depend on you to do that?
You depend on me, sir.
Okay, I'm ready to move to the next
Okay.
slide. And this is sort of the methodology and the specifics of the survey. It was done at a very random sample scientific survey in terms of its validity for those of you who question research. It's reliable down. It has a 5.73% margin of error, and we're 95% confident that that margin of error is applied to the results. It was a telephone survey. We did both landline telephone calls and cell phone calls. And looking at the demographics of the population, things like female versus male, we think it's pretty representative of the county population when we compare the demographics versus the demographics of the county. And then one of the things that we've added to the survey findings is, like if it's say 10% of the county has a particular characteristic, senior population has a characteristic, we also use SEMCOG's population forecast for the size of Oakland County senior population age 60 and over to also include how many seniors does that 10% represent. And SEMCOG projects that in 2020, there are about 309,125 seniors. So that's the senior population that we used for this report. Any questions about the methodology? Okay, then Barb, we can move to the next slide. So in terms of the findings, one of the questions we asked was, how often are you in touch with friends, neighbors, or relatives? And we give the options to the people of not enough, about enough, or too much. And the pie chart in the slide kind of shows the answers to that. Essentially about 16%, or almost 1 in 5 seniors, say they want more contact with friends, neighbors, and relatives. The vast majority of seniors are satisfied with their social contacts, and there's a slight majority that are having too much contact, which we hear a lot. And to put that 16% that's feel they don't have enough contact in the numbers. That represents about 16,000 Oakland County seniors age 60 and older. Ironically, the younger senior population and answers that more frequently than the older population. Although the numbers are relatively small when you subdivide it, so that's not a statistically significant verified number, even though it's pretty evident in the findings. And then we also asked, we thought it was important that 94.5% of seniors said that they have someone that they can tell just about anything to, someone who they can count on for understanding and advice. That's kind of one of the negative mental health consequences of social isolation, if you feel like you have no one that you can count on. But that means about 20,000 seniors say they have no one that they feel like they can confide in. If you have questions, please interrupt me along the way. Otherwise, we'll move to the next slide. We asked seniors how they feel about their present level of social activity. And again, how much enough, not enough, and about too much. And again, 1 in 5 seniors say that they want more social activity. Actually, the previous slide, it wasn't 1 in 5. I think it was 1 in 6 seniors was the number that did not have enough social contact. And relative to social activity, that represents about 72,000 seniors in Oakland County who say that they want to be more socially active. The population that was lower income, below $25,000 a year in annual income, was much more likely, actually twice as likely, to say that they are not participating socially as much as they would want to. And to give you the raw numbers of the percents, 18% of upper income seniors were satisfied with their social activity, were not satisfied. For low income seniors below 25,000, that was 40% of the low income population would say that. So there's a real economic stability impacts the level of social activity satisfaction. And we also, the 7% of seniors said that social involvement is a serious challenge. We asked people, what are the most serious challenges you face? 7% said that social involvement is a serious challenge for them. And again, for the low-income seniors, they were 5 times more likely to identify that as their most significant serious challenge versus upper-income seniors. Ready to move on, Barbara?
A question. Kat,
Yeah.
You can unmute yourself, or do you want me to ask the question? Okay, so Kat Latosh is asking, is there any idea about how/why income impacts social isolation?
Well, if you're lower income, you have a lot of other demographic characteristics. You tend to be in poorer health. Educational levels are generally lower for that population, so you have more barriers to social activities. Many people don't want to be socially active because they have disabilities or conditions that make it either more difficult or less desirable to be out socially. And I assume that there's also a decreased level of opportunities for social isolation, or for social activities, but we don't have any findings in the survey to quantify that.
Okay, thank you.
Okay, move us along. So now this is so one of the things that we want to do, we call it a needs and a solution survey. So the idea is we ask a question about the level of socialization, but we want to know more information, kind of like deep dive stuff about how that affects people, so we can get a sense if we're going to do anything about the problem, we look for information that might help us do that. And so we ask people, if you're seeking to be more active, what types of activities are you more interested in being active about? And this is the list of the respondents and the number of people who responded. positively. One of the, I think, more key findings to me is the second most popular area of interest, which is participation in senior center programs. There's been some debate about the relevance of senior centers to seniors going forward as the baby boomers become seniors, but clearly the results of the survey show that senior centers are not dead. They're very much of interest. And so we've always viewed senior centers as being kind of like one of the tools our service delivery system has as a front line to try to address issues like social isolation. That's borne out here. The other interesting thing I would say is that we divided the county to compare people versus people living in the rural areas and the non-rural areas of the county. And for the most part, we saw very few differences. But in here, the people in the rural areas were actually much less likely to participate in senior programs than the suburban or more urban areas of the county, which I thought was interesting, and wondered whether that relates to I don't want to say the quality of the senior center, but the robustness of senior centers. When you look at some of the more senior centers in the outlying county areas, the programming and support oftentimes isn't as substantial as what you see in some of the more urban or suburban areas. And I think many people are familiar with like an older person's commission in a more suburban community, much more likely to attract things with its more diverse offerings for senior participation. And in terms of the quantify that 30 seniors in the non-rural areas were twice as likely to select participation in senior programs or to favor that. Next slide. So we asked people, what are the reasons that might prevent you from participating in community activities? And we gave them this level of options. Interesting that half of the items, or at least 2 out of the 3, are reasons that we can affect as a service delivery system and operators of programs, but the other half we can't. So, for example, people not knowing about programs that are available to them is something that we can control. The same number of seniors, or portion of seniors prefer to be with younger people versus older people. That's something that we can't control unless you have some super media campaign, but probably not practical. Some people say they don't want to be with those people, or the people at some of the social programs. Again, something that can't be controlled, but not the people that cannot afford it. You can influence that by having reduced or scholarships for program participation fees. Don't have a way to get there. Public transportation can oftentimes be a solution to that. And of course, some people say they don't participate because they're just too sick or disabled to participate in social programs. So that gives us clues if we want to increase participation in programs. What are some of the barriers that program designers should overcome?
Hello? Hello?
Yes,
Yes.
Ms. Curry?
This is Miss Curry. I'm a senior, and what you said was totally true. When seniors get together, if you happen to be a quote unquote young senior, when you get together with older seniors, you figure you don't fit. So I think that's kind of interesting. Maybe they should have different types of senior citizens.
Thank you.
That's true. I mean, part of it is ageism exists even amongst the aged.
Yeah.
And I think it's this phenomena that just about everybody thinks that they're really about 10 years younger than they actually are, and they place themselves in demographic characteristics. So some of those ageist factors that do come into play there. Next slide. And this slide is just to identify from a gerontology perspective. I'm sorry.
No, I skipped one. We're back to 7.
Oh, okay, the last findings, a couple of other questions we asked related to social isolation. What things cause, we asked, one of the questions is what causes you painful feelings, and we gave a realm of options. 3.8% of the respondents, or 11,000 seniors, report being stuck at home with no transportation causes them painful feelings. And then the second option that 5.8% of the respondents stated was that that's just social involvement in general, assuming it's an area of dissatisfaction, causes them painful feelings. And so in the survey, we asked about 4 different types of questions that relate to having social isolation be a concern. And it's interesting because like one person doesn't answer yes to all 4 of those questions. Some answer yes to certain things and others. But when we did the statewide survey, when we added up what percentage of the senior population said yes to 1 or more of the 4 questions that related to social isolation, it totaled 31% of all state respondents, which was surprising to us. And then moving to this slide, I just wanted to identify in terms of, I think, of tools we have at our disposal in the county to address social isolation. These are sort of what we see as the programs and resources that we have: transportation, friendly reassurance, friendly caller, friendly visitor programs, retired senior volunteer programs and other volunteer programs, senior centers, health and wellness classes, peer counseling programs, and communication and monitoring technologies, whether they be the personal emergency response buttons that help if I fall and I can't get up, or things like we're using now, which is the internet, Zoom, and communications. I would like to make a few comments about the communication and monitoring technologies, because we're depending so much on technology to communicate to people who are with the COVID. And then just to clarify, these results are pre-COVID survey findings. But we have about 33% of seniors, 1 in 3, are not on the internet, do not have computer access or telephone internet access through their telephones. So, and then of course 2/3 do. But for that, so what we're seeing now with the COVID and the staying at home is this digital divide between seniors who are online and who are not online and don't embrace technology is having a huge impact and serving as a barrier to our ability to use technology to reach out to people and address them. For our friendly visitor programs, they've stopped visiting and they've turned to calling people instead of doing direct face-to-face visiting. And we see that a lot of people believe that with COVID and other health risks being around, this may be part of the new normal in terms of having a greater dependence on technology, which means that the digital divide is really going to make it more hardship on the have-nots in terms of technology. How we solve that is probably not something that the county can do, but it's something I think as a society we need to turn our attention to and try to maybe accelerate the spread of technology, whether it's making sure that broadband is available countywide or people having access to devices that they can access other resources and individuals online. The last slide.
There's a question. Does the 1 in 3 seniors without online communication correlate with age, meaning the older person, the less likely to use the online technology?
I'd have to go back and look at the data. I don't have that in front of me at the top of my head, but I can get it and share it with it by email.
And then there's another question. The 33%, I think, is the same group of people. Does it include people with memory issues?
It may or may not. And we don't have a way to track that because having a memory issue is not a demographic characteristic that would allow us to sort the respondents.
All right. Thank you.
Okay. And so the purpose of all of our work is always not just to talk about needs and problems, but what are ways to address those problems. And that's why we try to make all of our data collections solution-based. So here are some of the.
Yeah, Jim, I hate to interrupt, but this is Eileen Kowal. You kind of jumped back and forth a little bit between a state survey that you did and the county survey. So I'm just trying to get clear onto what these percentages and whatnot that you're speaking about. Are they state or county? Because they seem to be different.
Yeah, thank you. Thanks for asking that for clarification, Eileen. All of the information here is Oakland County. I was a participant in a statewide survey, and then we did the surveys in each of our counties. There were just some different questions done in the statewide survey than was done in the county survey because we had county people wanting some changes. So, and our level of data analysis is more limited to the county surveys than it is to the statewide data. Wayne State does data polls for us for the statewide survey. So that's why, so there's the 1 in 3 seniors is a statewide figure. But we would assume that it's pretty comparable to Oakland County as well. So that's why I use it somewhat interchangeably. And the, when I said that the 31% of seniors answered yes to one of the 4 social isolation questions, that's a statewide result. We don't have the ability locally in terms of our analysis capabilities to do that comparable dive for Oakland County. Okay. So in terms of some of the solutionary things that we think as we think about an action, identifying and promoting and adopting best practices that reduce social isolation among older adults and reduce the risk of social isolation and achieve positive outcomes. So that's always the first thing we think about is, let's not think about reinventing the wheel. Let's think about what are some strategies that are being used to address successfully social isolation, and are those strategies having a positive impact in terms of outcomes. The second is designate the reduction of social isolation as a goal in the Oakland County Senior Advisory Council annual plan. So Area Agency on Aging, we're an advocacy organization. So we're very data driven, but we use our data to advocate for others to be a part of looking to solutions. And so one of the things that we would say is maybe this is an issue that the Oakland County Senior Advisory Council could take up in terms of looking for practical solutions or strategies for Oakland County as an idea to consider. The third is social isolation is being recognized by health systems as a social determinant of health, and some are advocating that it be considered a public health issue and be a part of the area of jurisdiction and responsibility for actions and for the public health departments. Again, this is just a generic designation, and hope Kathleen Forsley doesn't get upset with me putting that out there. But if my email blows up, we'll see. And then the last thing is to encourage organizations like foundations, United Ways, charitable organizations to prioritize older adult social isolation as a senior health issue, and to consider prioritizing, soliciting, and accepting grant proposals that address solutions to the social isolation problem. For example, I think of the Michigan Health Endowment Fund, which is the largest health-related fund in Michigan. Our advocacy message of the Health Endowment Fund, which does a lot of funding of programs in this county, is make social isolation a priority like you have other health issues in the state of Michigan. So those are some things that, sort of off the top of my head, are things that we can try to promote and when I say we, I think of us as Area Agency on Aging and potentially this organization as some next steps to try to make some improvements in the problem. And I think that was the last slide.
Excellent. Thank you so much, Mr. McGuire. These findings are very insightful and important as we, move along and think about solutions to tackle social isolation, and having the direct feedback and data from seniors themselves is significant and very important. So I appreciate your time in sharing these. Does anybody have any questions that they'd like to ask Mr. McGuire? Okay, seeing none, I'd like to move on to our last one, which is our Health and Human Services Department Director's update. And I believe is it Kathy? Are you with us?
Yeah, so she was with us, but I asked her to turn the camera on, and she said she does not have ability in her office, so she's going to a conference room, so she can turn the camera on. So she will be with us shortly.
Excellent. Is Leanne with us, or is Kathy now?
Kathy is, yeah. So Leanne joined, but Kathy's meeting was over, and she's going to join us. It's just my fault because I asked her to put the camera on, and she would have to go to the conference room.
That's all right. Technology can be a challenging sometimes. That's for sure.
We know that. Yeah.
Absolutely. Does anybody have anything they want to share, comment on in the meantime? All right, I think I see Cam.
Yeah, well, I tell you what, it's like preaching to the choir, listening to Jim. The Senior Advisory Council works really hand in hand with the Oakland County Health Department. We actually are up underneath Kathy Forsley, and we work very closely with AAA1B and very closely with our senior centers. And a lot of what he says is spot on. When you were talking about having folks having the ability to communicate and so forth, a lot of it comes down to, do you pay to feed yourself, or do you have a television or whatever? There are a lot of seniors that are very literate as far as how to use communication devices, and there are a lot of them that are not and do not want to be, and some of them cannot because they can't afford to do that. Transportation. If you were talking to our Senior Advisory Council reps, a lot of the senior centers will tell you the same thing. The funding across the county is basically all over the map. Okay, as far as being able to transport seniors to senior centers that want to go, because they either having to do it themselves, it's just all over the map. And of course, you have seniors like me who can jump in his car and go where he wants to, when he wants to. So there is all kinds of issues. Okay. And like I said, when I'm talking to the Jewish Community Center, they say it's transportation. Okay. Other ones, it's communications. I've got senior centers that fund themselves. I've got senior centers that are paid for because their community is paying for them, giving them the money that they need. So there's just a lot of issues, okay? And it all kind of comes back to, like you say, how do you communicate with these folks? How do you give them the information they need to be able to do what they need to do, or at least be kept up to speed? Right now, in a lot of the senior centers, it's the Meals on Wheels folks that are communicating with the shut-ins. I mean, that's the what they've got. So as we get into this, if you don't know, you're gonna find out that there's a big disparity across this county, from the very best to the very poorest. And Jim was absolutely right. You get out into the upper parts of the county, it's just as bad as it is down in the lower parts of the county. So what do we do? Well, that's just my comment.
No. Thank you, Cameron. I greatly appreciate your perspective and thoughts on that, because there are so many areas within looking at social isolation and how do we connect our seniors, because there are so many different barriers. And the goal really truly is what can we do to impact the most seniors? And I think that that's going to be one of the most important things that we all keep in mind, because there are a lot of barriers throughout Oakland County. There are different regions and there's different needs and there's different concerns. But our biggest overall goal is, how do we still connect our seniors and decrease that social isolation piece? Thank you so much. Is there anybody else who'd like to share comments? Barbara?
I have a question for Jim because he mentioned the health endowment. Didn't they do the statewide survey for the seniors?
Yes, they were the funding source for the statewide survey.
Okay, and then do I remember correctly that the AAA1B did some kind of COVID survey as well, or it was the Health Endowment Fund?
We've done some surveying of the seniors and providers in the county related to the impact of COVID on seniors, and those are those brief 1 or 2 pagers I think I've been sending around to an audience. I don't know. I think I sent you
Yes,
1 or
yes,
2 of those.
I can send it out to. So unfortunately, there was a technical issue for the director, and she's calling back in, so we won't see her beautiful face on camera. So, Ms. Forsey, can you hear us?
I can. Can you hear me?
Yes, ma'am. Thank you. Sorry about it.
Today has been nothing but technical issues over here.
Well, thank you so much, Kathy, for taking the time to be with us today and just share some updates on what's been happening within the health department in regards to our seniors. So thank you so much.
Absolutely. So just to give you an update, there's a number of things that are going on, although they're we have a lot of things going on right now that I'm going to talk about that are very COVID focused. They are very useful, everything that we've been doing to inform us, really bringing to light about isolation issues as well. So one of the things that we are doing is that every long-term care facility, and including independent living, has been assigned a public health nurse, and they check in with them once or twice a week. Working on a number of issues, getting case counts and reporting from them and finding out what their needs are, but also talking through a lot of issues that are arising while they're in this lockdown. Then that information is brought to us, and every Friday we host a call in the mornings with our long-term care facilities and in the afternoons with our senior centers. And so with this exchange of information, it's been very helpful in both determining what the issues are that we're seeing, and then specifically in terms of isolation issues. As you all well know, that the longer our seniors are kept in isolation for their protection for exposures to COVID, the more our facilities are seeing issues with mental issues. And so that's a very important thing for us to consider. And they are trying a number of things to overcome that. But quite frankly, our seniors need to hear from and see and interact with their families. And that's very important, just as it is when COVID is an issue. We really are concerned about our seniors that are isolated in their homes or wherever they may be. So we have these calls trying to look towards the future of opening up, and what does that look like, and what are the steps that they can take now to encourage some engagement with their families. And also, senior centers are very anxious to reopen, and we keep informing them that bringing a place to congregate for seniors to congregate is risky. It does not come without risk. So we also have been looking across the nation at some best practices that are occurring. How are our senior centers keeping seniors engaged? We know that it's very important to have regular and reoccurring communication with our seniors, no matter where they live, if they're in a senior facility or in their homes. Many senior centers have taken on a new role, a very important role, of making what they call wellness calls. And so across the nation, that has been very valuable. There's a lot of accounts about that out there, that checking in with a senior, not just asking how you're doing, but really having a conversation with them, and they're making attempts to call the people that they're connected to at least on a weekly basis. Also trying to send things in the mail to them. I know Fairfax County has a really great program called Senior Center in the Mail, and every month they send out a package of things, and also trying to encourage them to engage with the outside world. I thought it was really creative that they had a bingo card where you need to color in every square as you complete the task on the bingo card. And a lot of it is about reaching out, calling a family member, calling a friend, and really trying to get them to do things on a daily basis to engage in the outside world. There's also a lot of efforts in our senior centers across the nation to take this opportunity to really work one-on-one with people to help them become virtually connected. And they seem to be having more success with that than they anticipated. And so we look forward to them continuing that good work even after COVID is over, and maybe when they can get back to a point of doing maybe one-on-one appointments in the office first, and then moving on to small groups. In terms of long-term care facilities, they're beginning to look at taking small steps, and when the governor's permitting that in the orders, and there's some question of whether or not that could be permitted now. To have outdoor visits, we're very fortunate that we're approaching a season where having an outdoor visit is more possible than it was in the last couple of months, and still providing social distancing outdoors, but giving them the protection of being outside, and then not exposing the facility to the risk of people coming in, visiting on the inside of the building, perhaps bringing exposure risk to others while they're there. So there's opportunities there, and we continue to work with them both on the calls and on a one-on-one basis. Isolation has been something that we have been concerned about for some time, as more and more seniors elect to stay in their homes as long as possible. While they're very mobile and can get out to go to attend things, that works very well. But we know that over time, there's more and more concern about staying in the home and not interacting and engaging with the outside world. COVID has really brought this to light as we talk to so many people from the senior community. We have regular town halls with the county executive, with the seniors, answer a lot of questions. We hear a lot about their need to engage with family. And so this is definitely something that I have intended to take back to Senior Advisory Council, and we continue those discussions and think about better ways, new ways that we can really work on engagement, including the Health Division really working on a public campaign, not directed at seniors, but rather directed at seniors' families, to remind them of the risk of not having regular and routine communication with their senior family members, and different ways that they can be engaged, even if they don't live near one another, but really helping them understand the importance of that. I know that we would think that this isn't something we need to educate a community about, but as families get busy and involved, I think it's something that gets forgotten or delayed, and to let them know, the statistics around not having that engagement could be valuable. And I know there's a lot we can do to get that information out into the community in a really good way. So that's really what we're doing right now. As I said, it's all very COVID focused, but this is part of a COVID problem as well. It's really been accentuated during COVID. So I don't know if you have any questions for me or.
Yep.
Or not.
Yep. Thank you so much, Kathy. We do have a question in regards to the comment that you had made early on about the cognitive capacities and issues that you're seeing. Are you seeing depression, anxiety? Are there other additional cognitive mental health issues that you're seing or
Well,
having people report on?
It is definitely both of that. And the other thing is very much more forgetfulness that's being noticed. And I think that there's concern for some, depending on where they're at in the spectrum of long-term care. There's also very, very deep concern that they start to forget family members and won't recognize them when they open up. There's a lot of concern about that with these long-term care facilities. So we and the governor have been working very hard at encouraging them to at least help them with Skype calls so that they have a face in front of them while they're talking. That's very important. I know some places have attempted through the window engagement, which has turned out to be in many cases very stressful for the person that is in the facility because they don't completely understand what that's about because they don't understand COVID. And so those continue to be concerns, and trying to figure out how to work around that has been very challenging.
Okay. Thank you. Cameron,
Yeah, hi, Kath. This is Cam.
followed by Commissioner Colwell.
Hi,
Yeah.
Cam.
Kath, the other day I read the bulletin that came out from Oakland County about the toolkits that they're getting
Yeah.
ready to send out to the small businesses as part of the ramp up. Are they considering the senior centers in this process, or where are this question?
Yeah, senior centers, all they need to do is request one, and that's absolutely something that can happen. But the other thing is we are looking at building materials to assist them, but there's so many constraints right now, and we don't know how this is going to open up. When you look at the governor's Safe Start plan, she very correctly identified we're in phase 3, starting to transition to phase 4 possibly, and there's 6 phases. So even in phase 4 and phase 5, vulnerable populations are still identified as shelter-in-place populations. So how that's going to look in the orders, and her orders have been very specific in terms of long-term care facilities. So it's difficult to build a toolkit with them at this time because things are changing and we're not exactly sure what the timeframes will be. So that's why we've been having these calls regularly and routinely to keep talking about the issues, to be there to assist them. And that's why every single one of them has been assigned their own public health nurse to communicate, anytime they want. And Nurse on Call is there in a minimum 5 days a week. Most weeks it's been 7. We're scaling back just slightly, but we make ourselves very available to them to answer their questions and help them through the difficult decisions that they have to make.
Okay.
Excellent. Thank you. Commissioner Colwell.
Thank you. Kathy, I was really intrigued by the Senior Center by Mail program that you talked about. Can you possibly provide any information for us on that? So maybe we could look at doing the same for some of our senior centers if we can get something like that going.
Yeah, we have been talking to our senior centers about that program. It's Fairfax County that has that program. Also, the National Association of Senior Centers has been communicating with them, and they just recently had a webinar where Fairfax County got out and talked to our senior centers about that program. I don't have anything in writing from Fairfax, just what I heard on the senior center webinar. But certainly, we can compile best practices that we're seeing, and we are making sure our senior centers are aware of that.
Yep.
Okay, great, thank you.
Excellent. Amy, did you have question, comment? No? Okay.
I do have one
Again, for a
more.
second time?
Yeah, I do have one more, but Kathy was talking about the senior centers, making telephone contact with the seniors. It seems like one of the things that I don't say we're missing, are the churches. We need to start engaging everybody, especially if you're a member of a church. If the person in the senior center belongs to a church, if it's not their relatives calling, maybe it got, you get because we receive wellness calls from our church. I've even received a wellness call from my jeweler down in the Caribbean. I guess he wants to make sure I'm okay. But the idea is just the idea that somebody is concerned about you does help. Like Kathy says, it's tough to look at somebody through a window and they not understand why. But the more ways that you can stay in touch, whether it's the pastor of the church or, a lot of the churches, that's what they're doing. They're calling. We need to make sure that everybody has similar toolkits, and if you get everybody engaged, that will help. It may not be the total answer, but it will definitely, have an impact on isolation.
We agree with you, Cam, and that is one of the things we've talked about in terms of doing a community-wide campaign, that it's not just geared, and I probably misspoke, it isn't something that should be geared just to family members and friends.
Mhm.
It takes a community to really engage, to make seniors feel like they're part of a community, and absolutely the faith-based organizations play a key role in that. And although some are doing that, I don't know that all are doing that, and that's something that we want to work with them on that. And there, as you say, there are others, including doctors' offices, and there's all kinds of people and businesses and organizations that could play key roles in helping our seniors feel like they're part of a community.
Thank you. Kathleen?
Yeah, I want to echo what Cameron's saying from a slightly different flavor. I come onto this group representing Sage Metro Detroit, which serves LGBTQ older adults. And a couple of years ago, we launched a Friendly Reassurance program. And, at the time, they weren't like all the rage among mainstream providers because there was more emphasis placed on in-person connection. But for LGBT older adults who are like vastly dispersed around the Metro Detroit area, who are often more socially isolated than non-LGBT elders, and very concerned about being discriminated against or mistreated or having someone come into their home and say something nasty about them. The Friendly Reassurance Call program was really successful. We got a number of people involved in it, and people felt really comfortable because they knew another community member was calling them. So there was a safety factor to that for them. Our executive director is also working on her PhD and conducted some research around our callers and found a reduction in both depression and anxiety levels, and recently published an article about that. So I think the Friendly Reassurance Calls can be really helpful. I love the idea of working through the churches for individuals who are deeply connected to their faith communities. And then also some of these other subpopulations like the LGBTQ community, like specific language communities or specific cultural or nationality communities, that people are going to feel safer, more comfortable if someone like that is like them is contacting them. There'll be a sense of familiarity and comfort there, I think, that will be higher.
Great.
Excellent. Thank you, Kathleen. Is there any other questions?
Hi, this is Miss Curry again.
Hi, Ms. Curry.
Okay. In addition to my situation, I have a mother who's in assisted living. With her, FaceTime is important.
Oh.
Also, art therapy. She also likes animal therapy. She also likes virtual tours to the Art Institute, to the zoo.
Okay.
She also likes talk time, which you get on the phone and just don't say hi. You have a conversation with her.
Mhm.
And the last thing, peer counseling. When seniors have the opportunity to get together with one another and give advice to one another.
Yep.
Excellent. Well, thank you so much for your comments, Ms. Curry. Kathy, do we know, I know presently right now, obviously our living facilities, our senior living facilities are currently still in lockdown. What does it look like within inside? Are seniors able to communicate, see each other inside these living care facilities?
No, they're not. They're basically in their rooms or their apartments, and they are not congregating with each other. There are some instances in the assisted living where, to manage eating, a few of them at a time might be brought to a dining room, but they're not sharing a dining table. Certainly the independent livings are not having dining room service. It's actually been prohibited in the governor's orders. We expect that might start to change in order to assist our facilities to get back to a more normal state sooner. We are really working hard to get into every facility to do comprehensive testing of all of the residents, all of the staff, from the medical providers to the maintenance people that are working there, the food service people. And when we have that information, more than 50% of those testing positive are asymptomatic. That's really important knowledge for a facility to have, to understand how to better protect or to institute infection control measures and strategies that will really stop the transmission of the virus under their roof. So we're working hard to get that information for every single facility and then work very closely with them so that they can be confident in how they might move into some small group situations with 10 or less at first, still socially distancing. We still want them to be practicing PPE or face coverings of some kind, as long, as they are medically able to utilize that. So it's still pretty much in lockdown, but they are really on the cusp of making some good headway in terms of the next small steps they might be able to take.
Sure. Kathy, do we know what percentage of, and again, this, not asking for specific numbers, but do we know at least a ballpark percentage of how many of these senior assisted living facilities have already been tested across Oakland County?
So let's see, we just got started on this. So we have done 23 facilities, and we have about another couple of dozen scheduled in the next couple of weeks. And of course, that sounds really slow, but we really are still in ramp up phase, because how we're accomplishing this is we certainly wouldn't have enough staff to do all of this testing. So we've been partnering with paramedics in our communities and been training them how to do specimen collections and how to work through the process while we manage all the paperwork and the lab requisitions and get the testing done. So as more and more paramedics come online, we have more and more capacity. Our only limitation is how many testing supplies do we have. We're limited by that. So we're going through this as quickly as we can, but every day there's a cap. We're using 5 different laboratories to do testing, but even when they're all running maximum capacity for us, we have a limit every day as to how many we can test. So it's going to take us a number of weeks to get through all of the facilities that we have. I can tell you that as we're not seeing a lot of, I thought I had cases here I could report to you that we are finding from that. I don't have that at the moment, but I can also tell you, like I said, we are discovering of the positives, more than 50% are asymptomatic. So that poses a challenge, and so that's what we're working through. I can also tell you that 157 of our senior living facilities have been impacted by COVID. We have had 1,744 confirmed cases, and 500 among the residents, and 586 staff were confirmed, and there have been 475 deaths in our facilities. So we have a lot of work to do, and that's why we're working so hard to get this testing done, because before they start dipping their toes in the water in terms of bringing people together from the outside, and even before they start congregating on the inside, they have to be armed with information so they do it safely.
Sure. Well, Kathy, I cannot thank you and the health department enough. I mean, the work that you guys are doing is just incredible. We know how busy and crazy of a time this is, and you guys are just doing such a fabulous job. And I want to say thank you for that. The work that is being done right now is absolutely incredible, with bringing everybody together and doing the best we really truly can given these circumstances. So thank you and your team for everything that you guys have been doing, because truly it's been incredible. So thank you.
Well, thank you for those kind words. And I can tell you, I speak about my staff. It's done with huge compassion and enormous commitment to this population.
Absolutely. Well, thank you so
Kathy.
much. Does anybody else have any questions, comments that they'd like to ask Ed?
Oh, sorry.
Commissioner Colwell?
Yeah, I just wanted to comment on something I saw in the news last night, I think it was. I mean, not everybody can do this, but I was really impressed by, there was a nursing home where basically the staff moved in with the residents for like 60 days. So nobody was coming and going, and there wasn't any chance of anybody bringing the virus in. So I thought, wow, that was really amazing. Finally, they just did leave and go back to their families. But I thought that was just absolutely remarkable that they cared so much about the people that they became their family and moved in with them. So it was very heartwarming.
That is amazing. And I can tell you that I have witnessed that personally in some group homes where some residents got sick, and the staff then moved in with them and stayed there, so there would be no more coming and going of people that were working there to keep the rest of the residents as safe as possible. So I have seen some heroics in that regard as well. So you described a really tremendous picture of compassion.
All right, does anybody have any
like to
further
add-
questions?
Yeah, I'd like to add a comment, and if I may, to Kathy. I want to commend you as well on the work that you're doing, bringing senior centers together and helping them manage this situation. No other county is doing anything close to what Oakland County is doing, and so I appreciate that. We're very concerned about having a safe reopening of senior centers when the time comes. And the problem is compounded by the fact that senior centers are losing so much of their budget revenue because they depend so much on donations and fees and registrations and so forth. So we've been talking to some funders who are open to taking grants from senior centers when it comes time to open to outfit themselves to be safe environments. We're talking about promoting a no-touch or a touchless senior center so that you can go and participate in activities without having to touch the door to open it or to touch a faucet to wash your hands or pick up a pen to sign in on the sign-up sheet, things of that nature with people, staff with PPE. So we'd be willing, in one of our counties, we're organizing the senior centers to go together in a grant proposal to get the dollars to, when it's time to reopen, to outfit them to be safe centers. So if there's anything that we can do to support any interest that Oakland County senior centers have in collaborating to have the resources to do what they need to do to be safe centers, we want to be supportive of that. We've got one foundation that will be able to accept applications in August, and they've already agreed that applications from senior centers will be welcomed. So take advantage of the work we've done in that area if you would like.
Absolutely. I really appreciate knowing that. Thank you very much, Jim. We'll be in touch with you on that.
Ready. Any other further questions or comments while we still have Kathy online with us? All right, see you then. Thank you so much, Kathy, for your time and information today.
Absolutely. Thank you.
Thank you. Have a great day.
You too.
Thank you. All right, Barbara.
I have a couple of housekeeping announcement. First of
Barbara,
all,
before we go into housekeeping, can I just receive and
Yeah.
file the
This was-
PowerPoint from Agenda Item 1?
this
You're
was
amazing. Awesome. I'd like to receive and file the PowerPoint presentation by Area AAA 1B. We need a motion.
So moved.
Moved by Commissioner Colas, second by Commissioner Lubes. Thank you so much.
Thank you.
All those in favor signify by saying aye.
Aye.
Opposed? Excellent. Motion carried. Moving on to our last portion, other business. Barbara.
Thank you. So another housekeeping, I just want to let you, so I will be emailing every task force member with the presentation, so you have it for your file. Also, Mr. McClure asked to send the link from the previous meeting. I will send all of you the link. It's on YouTube. This one should be out tomorrow or the latest on Monday. We are short on staff as well, and we're trying, this is why I'm not really good at clerking. And lastly, Christine Faroja, Director of Senior Services in Bloomfield Township, sent me a link to a social wellness calls webinar that is unfortunately happening tomorrow. So it's really quick, but I will send you the link as well. And it's done by National Council on Aging. It's a free webinar open to everyone. So I will be sending it momentarily after the meeting. If you know anyone who can benefit from it, please forward it.
Excellent. Thank you, Barbara. Is there any way too that we can attach along with the information being sent today with the survey results that were done just here in March of 2020?
Yes.
In light
yes,
of the COVID-19?
Yeah. Do I have a permission from Jim and Amy? Okay, thank you.
Excellent. Thank you so much. I think that's very useful information to put along with that.
Okay.
Excellent. Is there, well, before we go on to our adjournment, it looks like we are looking at being slated our next meeting on June 11th.
Okay.
Barbara, are we still good with the June 11th date?
It's the June 11th at 9:30. We have a full board meeting.
Okay.
Oh.
So is there, I would like to meet sooner than later.
Yeah.
So do you think it might be, what are the thoughts of the task force members on having the meeting next week and then breaking for 2 weeks after that? Because I think by next week, we can kind of talk about our next short-term move with a solution.
Would 1 week
I'm
be
fine with that.
enough?
I'm fine with that.
Yeah.
Okay.
I don't have any place to go, so
Okay, so we are looking at June 4th.
the 4th?
Yes.
Okay.
Okay, and I assume it looks like 11:30 is a good time.
Yeah.
Choice, Commissioner Nelson.
That's great. Perfect. Because that way, I think some of the things that we'll jump right into once I think sending out the email information today, just to kind of give people that to put some eyes on it and let it sink in a little bit more rather than just hearing about it. But I really, truly, firmly think that going into next week's meeting, I really think it's going to be beneficial to have a couple weeks off, because it's going to give us some time to then look at how we're going to execute some of the things that we can do immediately, and then look at putting a priority list together of these are the intermediate things. But just in light of having that board meeting the following week, I definitely think that if we could do it next week, would be great. And then just so everyone kind of gets an idea of, I'm really truly thinking that after our meeting next week, it'll probably be like a 2-week break in between our next meeting. Barbara, you want to say something?
Yeah, I'm just brain thinking. So if we come up with some solutions by next week, there we can prepare resolutions to be introduced on the June 11th to the full board and go through the committee review if this is what the task force would be
Sure.
looking. So I would personally just, I don't know if the 1 week is long enough to propose short-term solutions, but if other task force members feel strongly that we can accomplish something
Sure.
within the week, I am open.
So I definitely hear what you're saying, and potentially a potential thought would be to take a look at one of the things I think we all heard today was there's a lot of things to consider. There's a lot of variables and barriers to a lot of the potential solutions, but potentially maybe one of the things that we can really look at next week is how we can open up potentially a grant process. And then that way we could divide our group members on the task force of, hey, let's get into smaller groups and look at that criteria for a grant application. I think that's going to be one of the quickest ways that we could start looking at having solutions be executed. But I also think it's very important to have the expertise of members on this task force contribute to what that criteria is going to need to look like, and be fair and just and in that process. So thoughts, questions, comments on that, Cam?
Yeah, well, one of the things that, now you're talking about going and after things. One of the things that we may also consider, because Oakland County is so proactive, are action items. In other words, things that can be done while we're down in the Grimley trying to figure out how to get money and things like that. But I always say my magic wand is about this long, that long. I have to prang it a whole lot of times. But action items like we were talking about, having churches, these are things that you can be doing in the meantime to help. Okay, and that doesn't cost a whole lot other than somebody taking the time to do something. That may not be, just thought starters. Where like we get these things from Oakland County talking about the grants and stuff that we could then cascade that out, or what do you go toolkit, I suppose.
Sure.
Things that the various organizations can do to try to help, and it's specifically related to seniors, but it helps anyone with social isolation. If you think about it, a lot of things that are out here for seniors impact everyone. Like the curb cuts and the sidewalks are a good example of what I'm thinking about. Something that they put in, but for old folks, it's great not to trip over the daggone curb. You know what I mean? So what things do we have, the low hanging fruit stuff that we might be able to say while we're down in the Grimley trying to figure out getting funding and things? What can we do as Oakland County folks to help in this process? Thought starters, churches, community groups, the neighborhood. Are you calling your folks? Are you calling seniors? Have you contacted a senior center to ask how they can help volunteer? A lot of us are blatant. Well, you say I'm retired, but I'm not retired because I'm involved in so many different things. But because I can, and even if I cannot leave my house, doesn't mean I can't get on the phone, right? Or do a portal call like I do with my grandbabies, you know. So how can we get engaged, Oakland County? Okay, and then while we are talking about how can we fund our and have some kind of sustained process for taking care of some of these issues that have always been here. My comments.
No, I appreciate that and value that. I think there's a couple things I think we can all do now, and it's going to be on each and every one of us to execute that. But I think looking at the assurance call piece,
yeah,
I know that there are some really great programs going around town. Where those programs are, what's required for those programs, I'm not sure. But that's going to be something I know I'm going to try to seek out over today and tomorrow. But I think one thing that we all could do pretty easily is spread that message on social media. Pick up the phone and call someone, and maybe, you know, have like a 5 people a day, pass it along, do a chain. But I definitely hear what you're saying, Cam, in regards to some of those short-term action pieces that we can do. I definitely, Barbara, I'd like to take a look at maybe Kathy, or even you, Jim, if there's any resources that you know of right now that are actively doing simple things that we could start doing today, tomorrow, please let us know.
Yeah, just Amy and I can go to our database of resources, and we'll prepare a listing of all of the friendly reassurance programs in Oakland County and with some status and contact information. I think, Amy, you can probably get that done by tomorrow.
Yeah.
Kelly,
just take it off of what Jim is saying. You know, Commissioner Kowal talked about this unique program where there's mailing out stuff. We've got senior centers that have some really good best practices. I have no problem borrowing somebody else's great idea and giving them credit for it if it means that I don't have to figure it out myself. We've got senior centers that are doing some very unique things in their respective centers that may or may not be replicated across the senior centers or across the county. You know, it doesn't have to be just senior specific.
Sure. Amy, followed by Kathleen.
Yeah, I was just gonna piggyback off of Jim. We can go ahead and try to collect those friendly reassurance and other resources, those low-hanging fruit programs and agencies, and see if we can get a contact information and phone number. So.
Thank you so much, Amy. And Barbara, once we do have that information, let's get that going on our social media so we could just start sharing and have it be a same message. But also resources are, you know, there and accessible in one area. So that'd be great. Thank you so much, Jim and Amy. Kathleen.
Yeah, I'm wondering if it might be possible to utilize some kind of online collaboration tool for our next meeting so that we can start to see some of the ideas pop up. We can start to see maybe what resources might be available or where organizations already are doing this that we could tap into. And we could also begin to think about which might be short-term, medium-term, and long-term ideas so that, you know, we have the kind of a visual. Now it's kind of like all these words and ideas are popping out. It'd be great to be able to see those in one place.
Yeah.
Excellent. I will definitely be following up with our wonderful Anna Elizabeth Barbara in regards to that. So thank you. I think that's
mind is would everyone have access to Google spreadsheet that it's edible by everyone? You don't have to have a Gmail address. I will invite everyone, and then we can create different documents within the one Google, and then it will make a note who changed what. So maybe we can try with that, unless maybe Sam or Dan have a better idea than Google's documents.
I think for the group that we have here, I think Google spreadsheets probably is the most common and easiest. So let's do that.
Thank you. Okay, perfect. So I'm going to create this, invite everyone, and we will go from there.
excellent. Thank you, Barbara. Is there any other business to come before the task force today? All right. If not, without further objection, I declare this meeting adjourned at 12:53 p.m.